In the meantime, I just wanted to welcome everyone. My name is Dr. Elizabeth Lageson, and I'm the interim director for the UCLA Tarjan Center, which is our University Center for Excellence in Developmental Disabilities. And on behalf of the Tarjan Center faculty and staff, it's my pleasure to welcome you all to our distinguished lecture series, and also to welcome and introduce our distinguished speaker, Dr. Rebecca Khamis. Now, Dr. Khamis is currently a postdoctoral fellow at the UCLA Peers Clinic. She received her PhD in Human Development and Family Studies with an emphasis in couple and family therapy at Michigan State University. She has 8 years of experience working as a couple and family therapist for individuals with intellectual disabilities and their families, as well as conducting community-engaged applied research in the area of sexuality and romantic relationships. Dr. Khamis's research and work focuses on the systemic risks and challenges of developing a positive sexual identity for older adolescents and adults with autism and intellectual and developmental disabilities. And this includes understanding healthy, intimate relationship experiences, providing sexuality education for adults with disabilities and their families, as well as advocating for sexuality rights, including access to comprehensive education and healthcare. Her work is based in the principles of community-based participatory research with an emphasis on program evaluation to inform wider policy and practice issues. In her postdoctoral fellowship at UCLA, Dr. Khamis also co-facilitates the UCLA Peers for Dating study, which is a randomized control trial of a telehealth intervention to help autistic adults develop and maintain romantic relationships. So today, Dr. Khamis is going to be presenting what I'm sure will be a very interesting and informative lecture on comprehensive and systemic sexuality and relationship education for young adults with autism. So please join me in giving a very warm virtual welcome to Dr. Rebecca Khamis.
All right, thank you so much, Dr. Lageson. Like Dr. Lageson said, today I'm going to be talking to you guys specifically about sexuality and relationship education for young adults with autism, and specifically making that thinking about it in a more comprehensive and systemic manner. So I did actually have a little about me slide, even though I totally forgot that we were going to have a whole little introduction to who I am. So I'll go through this really super quickly, but just want to highlight a few of the things that I think are just important in my background, so that you know like exactly where I'm coming from when I'm talking about a lot of this stuff. So like we already said, I'm currently a postdoc at the UCLA Peers Clinic, working specifically with the young adults. I also am a couple and family therapist, so that is a lot of where my background, and that is where my licensure lies as well. I also am a sex educator and sex therapist. That's where I kind of come from clinically. And then when we talk about research, I have a background in program evaluation and community-based participatory research. I also, on a personal level, am a very fierce advocate for individuals with intellectual and developmental disabilities, especially in the area of sexuality, romantic relationships, sexuality education. And I also am a family member of an individual with a disability. So just to give you kind of a comprehensive picture of what, my background looks like, the areas that I'm coming from, and also so that, if you have any questions relating to any of these kinds of areas, you can go ahead and just let me know. All right, so today I'm going to talk specifically about sex education, give a little bit more of a background, a little bit more information, and then talk about how we want to make sex education comprehensive, systemic, and developmentally appropriate, what that really means, what that could potentially look like, and how that can help to increase the health and well-being of individuals and young adults with autism, how that can decrease abuse and exploitation, and lead to better interpersonal relationships. So what I'm going to do today is I'm going to give kind of a brief overview of a lot of things. We'll talk about sex education. We'll talk about making it comprehensive, making it systemic. I'll provide some examples throughout my clinical work that I've experienced, and I'll also talk about some of my research projects. So I'm going to be giving sort of a quick introduction to a lot of different things. And so if you have any more specific questions about a specific research project or about a specific clinical experience, please feel free to either email me at the end or to put it into the chat, and hopefully I can give you a little bit more information. But I'm not going to talk very specifically about a lot of these research projects. So if you have questions about, more of what we did in some of those, you can go ahead and let me know. All right. So first of all, I want to talk and start just by talking about sex education in general and what we know about sexual education, and specifically for adults with disabilities. So I'm going to actually go ahead and move this thing out of my way here. All right, there we go. So I can see my notes a little bit better. All right, so when we talk about sexuality education and when we talk specifically about autism, a lot of times we have to talk about intellectual and developmental disabilities more in general, which is what that IDD up there stands for. A lot of times when we talk about autism, or when, that's kind of the category that it ends up falling under. So we have to talk about it a little bit more generally, especially because a lot of studies or things that people have looked at, they may have looked at autism in a more kind of, specific way, maybe a little different, like nuances, different areas, things like that. But when we talk about it generally sort of nationwide, it falls under this sort of umbrella term. So we know from a nationwide 2014 study about sex education, we know that, there we go, that 56% of students with a mild intellectual disability had received no sex education in their lives, that 84% of students with a moderate or profound ID received no sex education. And there's estimates that around 40 to 60% of individuals with autism will leave high school with no sex education. And we're talking about, which I'll talk about more when we talk about comprehensive sex ed as well, but talking more about kind of the whole gamut of sex education, everything from anatomy and physiology to healthy relationships. We also know that 60% of teachers believe that students with ID could benefit from sex ed. So like I said, these stats are from a 2014 study, so a little while ago, but it was the most comprehensive kind of nationwide study that we still have. And we also know that potentially from what other people are finding in doing some studies like this in sort of smaller, different areas, kind of more specific areas of the country, more specific, like around topics, things like that. We know that this education gap is probably widening even further, because sex education is something that's becoming a little bit more of a talked about topic, something that people are, a lot of schools are wanting to actually include a little bit more. And a lot of times that's only for individuals who are typically developing, those who aren't receiving special education services. So as they start to gain a little bit, not a whole lot, but a little bit more of sex education as part of their school education curriculum, a lot of times those individuals with IDD are still being left behind. And so we're going to see that education gap widen even further. One of the reasons for this is, like I said, a lot of individuals who receive special education, they don't receive sex ed. And that's because a lot of states have this opt-out policy. Like I know, for example, here in California, we do have the opt-out policy, even though California does require healthy sexuality as a component to sex ed, which is not true of all states. Some states still require abstinence only. But California does require healthy sexuality components to sex ed. But if you are in a special education court or like group, or if you are have an IEP, you can potentially, your parent can opt you out of receiving sex ed, especially if it's kind of just a written agreement between the teacher and the parent is all you need to really be opted out of that. So, just thinking about how, even though a lot of states say that this should be part of sort of a comprehensive transition program, this should be important, there are still those opt-out policies, because a lot of parents and a lot of teachers for individuals who are in special education tend to want to focus on those social and vocational skills and don't really want to worry about sex ed, until maybe a little bit later, feeling like it might not be developmentally appropriate, but then not really making any sort of, accommodations to what would be developmentally appropriate. So again, we just see that education gap kind of widening because of some of those experiences. We also know that for these individuals outside of the classroom, there's also a lot of lack of real world opportunities to learn. So that could include talking with peers, talking with siblings, having previous relationship experiences, some of those ways that more typically developing individuals might, learn some of those things more in those real world contexts. A lot of individuals who fall under the umbrella of IDD don't have those real world opportunities as well. And we also know that if there is any type of kind of intellectual disability or any sort of processing, information processing disability as part of the diagnosis or part of the services that they're receiving, we know that there can be some difficulties with integrating information that they might get from things like movies or from porn or from peers. And if they don't have that sort of basic sex ed knowledge that they might get in a classroom, then integrating that information once they get that out in the real world is going to be even harder, which is just, again, going to lead to that furthering of that education gap. Right. So when we did sort of an intervention outcome review study, and when we looked at some of the different interventions that were out there in relation to sex education, and we were focusing more on interventions that existed for young adults. And so we found that a lot of times the focus when they were younger was on like anatomy and physiology. And then as they grow into adulthood, a lot of those young adult programs, the focus is more on abuse prevention and relationship development. So our study, we looked at a bunch of different curricula. We were limited to curricula that were, or the studies that were written in English, but we did have them from kind of around the world, as you can see from that map that we have there, all the different places where these interventions or curricula came from. And we noticed that a lot of these were, like I said, were focused on either abuse prevention or relationship development. But the relationship development curricula, those you can see on the graph there on the other side, the pink and the yellow. The pink are the abuse prevention studies and the yellow are the relationship development. So the relationship development studies have also really more become a focus just kind of in more later years and more later generations. But also that graph is a little bit skewed because that graph includes all of the curricula that we looked at. When you look at just the curricula or the interventions from the US, it still is a very, very strong focus on abuse prevention, was still the majority of what those interventions were aimed towards. So we do know that a lot of when you're looking at these interventions, one of the things that comes up, especially for the young adults with autism in these interventions, is that when you look at some of this lack of sex education knowledge, they still lacked a lot of that initial basic level of sexual knowledge, that anatomy and physiology. But when you combine that with things like social skills concerns, and also the fact that they have a lot of sensory issues that are not often considered, you see a lot of further alienation with these individuals and having some of these different experiences, which again, we have a lot of these interventions trying to attack that, but wanting to make sure that we attack that within the context of like social skills concerns and sensory issues that would also be helpful for them, or else that gap is just going to continue to widen. So we also know that sex education is a very nuanced topic. And a lot of times this often, in a lot of these interventions, it really only became the focus for the young adult, for their family, when it became an issue, when they actually started talking about wanting to engage in a relationship, or when something sort of happened out in the community, when it became sort of an issue is when it finally became sort of the focus. We also know that with a lot of these interventions and the individuals who are, delivering these interventions, the individuals who are in their lives, that there is, when it comes to sexuality, there is specifically this, myth of asexuality, and then also on the opposite end, the sort of myth of the perpetual offender. So the idea that they're either asexual, not sexual beings, or they're, they just don't know any better, and they're kind of perpetually going to be offenders of sexual behaviors. And because of that, that's why we create these interventions that tend to sort of skew on either end of that. So not really looking at some of the things that might be more in the middle there as well. So that's just kind of some background information on some of those interventions that we had previously looked at. To kind of add to that idea of that education gap. So one of the sort of unintended consequences of this lack of sex education, or this education gap that we see, are these healthcare consequences. So we know that a lot of these individuals have issues with basic hygiene, with health maintenance, and with health and reproductive advocacy. A recent CDC study that was published in 2020, so had looked at kind of pre-COVID, so in 2019, what were some of the healthcare behaviors of individuals with disabilities? Specifically around women, they found that 1 in 3 women with a disability do not have a usual healthcare provider. They also found that 1 in 4 women with a disability did not have a routine checkup within the past year. And this is important because a lot of adults with disabilities are required to get physicals and to have those checkups in order to get state-funded services. But specifically for women, they are allowed a lot of times to opt out of things like pap smears or mammograms. So some of those more, kind of reproductive healthcare needs that we, definitely need to be taken care of and be looking at more consistently, but those aren't prioritized, and they're allowed to opt out of those to receive some of those services. So just some things to think about. And if, they aren't receiving the education at the beginning that tells them that this is important, a lot of them do choose to opt out of that. So another thing to note when it comes to some of these unintended healthcare consequences is that you see a lot of over-involvement of guardians and caregivers, because the young adult themselves doesn't necessarily have the knowledge, they've been opted out of some of these sex education classes, things like that. So the parent or the caregiver, the guardian feels like they don't really know, the young adult doesn't know what to do. They won't know the questions to ask. And so you see a lot of over-involvement of guardians and caregivers in healthcare. And also, sex ed also is a very value-laden, issue. It's got a lot of taboos around it, things like that. And so a lot of times family members, they are the best people to teach and to be involved, but they also, a lot of those values or those taboos can kind of come into play and how then they interact with their young adult, and they help their young adult interact with the healthcare system, especially around issues of reproductive healthcare. So we also know that there are a lot of issues with unintended pregnancies, as well as kind of that final healthcare consequence that we see with this sort of gap in education, this lack of education. Give me one second. All right, so like I said, I'm going to be talking a little bit about some research projects, as well as giving you some examples and things that I've experienced sort of in my clinical life. And so one of the people I want to talk to you about today, I have a whole bunch of them, so I'll go through them really quickly. When you do see them, I'll just give you kind of the basics, but just to show this kind of, these unintended healthcare consequences that can happen from this gap in education, is a young adult named Amy. So she was a young adult who had autism. And when I was seeing her, she had already had 2 kids. So she had already given birth twice. She had a lot of sensory issues that were related to giving birth, related to menstrual pain, and a lot of things that were sort of a kind of, related to her autism and some of those issues, as well as the physical aspects of giving birth and some, like I said, some of that menstrual pain. And when we had talked about it, there was a lot of things that we ended up going over, even just showing her like pictures of ovaries and what those look like and what they do. And she was like, I had no idea that like, this is what my body was doing when I was, pregnant or when I was giving birth, and having to kind of explain some of those things to her. And then her being able to look back at that and be like, man, I wish I would have had a different way to tell my doctors about what I was experiencing or what was going on for me. She got a lot of people telling her like, you're exaggerating, or it's not that bad, or you just have to push through it. So really not recognizing kind of how her sensory issues might actually be relating to what it was that she was experiencing, and then that lack of access to kind of proper healthcare because of that. Another individual that I want to talk about is Linda. So Linda is an individual with both autism and an intellectual disability. She had kind of no level of guardianship of herself for most of her life. She had a hysterectomy when she was 23. Her parents had gotten her a hysterectomy without her consent because they didn't actually need it at the time. And also when I was talking to her, she was in her 50s. So this was also many, many years before, but we had talked a lot about having kids, and she had always thought she would have made a great mom and all of this stuff. And we eventually kind of found out through talking, and because I had access to her records and all that as well, that she actually didn't even know what a hysterectomy was. She had no idea that, she just thought she was too old to have kids. She had no idea that she couldn't actually physically do that. And we had to have a whole conversation with her parents where they explained to her what happened and gave her kind of the whole rundown. And she was very, sad about the fact that they had done this without her consent. But a lot of things where she was like, I had no idea what you were even talking about at that time, because she had also been opted out of sex ed for most of her life, and so had no idea what a lot of these terms even meant. So just kind of some examples of how kind of that gap in and lack of education can really impact individuals on a more personal level as well. Some of the other ways that we really see this gap in education cause a lot of issues is in issues of intimate partner violence and sexual violence, which is what IPV and SV there on the screen stand for. So we know that in the general population, about 20% of women and 2.6% of men will experience sexual violence in their lives. When you add on the label or the diagnosis of a disability, that number jumps to 41.6% of all individuals with a disability will experience sexual violence. And the same kind of for intimate partner violence, 25% of women and 10% of men will experience intimate partner violence, and that number jumps to 37.4% for individuals with a disability. We also know specifically that people who have an intellectual or developmental disability as their sort of label of disability are 7 times more likely to experience abuse, and women with an IDD are 12 times more likely to experience abuse. And a lot of this does come from that sort of that gap in knowledge, that lack of understanding, that lack of sexual knowledge, and that lack of healthy relationship knowledge as well. So we actually conducted a study of college-age women who had a disability, who had experienced some form of either intimate partner violence or sexual violence. And we kind of asked them about some of their experiences. And one of the kind of smaller takeaways of the study that we thought was really interesting was this idea of disability-specific abuse and some of the consequences of that. So a lot of these women experienced partners who would use their diagnosis, first of all, to create a connection, and then to kind of manipulate that connection. So as an example, like a more specific example, one abuser actually would say to his victim kind of all the time that, no one else would want you because of your disability. Or they use a lot of those derogatory labels, like calling them crazy or calling them a moron, and then saying, you're so crazy, no one else would ever want you. So you're lucky to have me. And then kind of also taking advantage of some of those misreading of social cues and sensory concerns that individuals with autism specifically experience. And so recognizing that these are things that, that they were specifically experiencing, that they didn't always have the language or the ability to talk about because they had already missed out on a lot of that sex education that some of their other peers had received earlier on. Oh, excuse me. All right, so some of the consequences that we see of this disability-specific abuse, we see amplified mental health symptoms, especially depression, self-harm, suicidal thoughts, those feelings of physical and emotional isolation, mistrust of others, which can lead to a lot of further abuse experiences, a lot of substance abuse. You see some of those quote unquote negative behaviors increase, as well as just an overall decline in health and a lot of experiences of physical injuries as components of their experiences. So just thinking about, again, kind of how this sort of gap in knowledge that is created sort of the very beginning when you don't get that sex ed information, and how that can sort of, you can see some of these unintended consequences even kind of later on. Another key thing to note when we're talking about sex ed, because I'll go into more specifically what comprehensive and what like systemic might look like, but an important thing to note is just the importance of language and how sex ed, even just at a basic level, what it provides is not only, more information and knowledge and all this stuff, but it provides a language for individuals to be able to use, especially if they're having abuse experiences, to be able to have the language to talk about what's going on for them. But even something as simple as, if there's an individual who's maybe experiencing like a urinary tract infection, and being able to explain what they're feeling, what's going on for them, and use those words, when they're talking to a doctor or talking to a caregiver, instead of having to just, use things a little bit more vague, like, oh, it hurts down there. Like, that's not really going to be super helpful, right? So even just giving them the language that they need to provide that information. And if they don't get that basic sex ed knowledge, they won't have access to that language. Another key piece that kind of exemplifies this is the issue of language and AAC users, so individuals who use augmentative and alternative communication, especially those who use like AAC boards or use iPads to communicate. A lot of times those boards and those iPads don't necessarily have sexuality related words. They won't, come preset with things like vagina or penis, and you have to kind of add those things in. And if they don't have those things to even be able to press the button to tell you what's going on, they're not going to be able to talk about that. So I'm going to give a few just kind of examples of why language and all that is so important. So one of the people I want to talk about is Taylor. So Taylor was a young child. She did not have a disability, but this just exemplifies the importance of using language. So Taylor was, like I said, she was a young child. Her and her mom and her whole family, whenever they would talk about her vagina, instead of using the word, they would call it a pocketbook. And because, they didn't like to talk about it, they didn't like to use that word. And then she started experiencing some abuse at the hands of an uncle who had moved in with them. And she started telling people at school about how her uncle was like touching her pocketbook, how he was trying to play with her pocketbook. He liked to play a game with her pocketbook, and the teachers had no idea what she was talking about. They were like, oh, good, I'm so glad you're having fun with your uncle, like not really knowing how to respond to some of that, until she finally said that out loud to her mom. And then her mom was able to understand what happened and was able to kind of, handle the situation. But that abuse continued for months, because when Taylor tried to tell an adult and she, tried to express to them what was going on, she wasn't using terminology that adult was, that they knew, that they had no idea what she was talking about. So that abuse continued for a lot longer than it needed to if she would have just had the words to be able to use in the first place. Another person I want to mention is Abe. Abe is a young adult who had autism, who ended up getting in trouble for public masturbation because he got kind of in trouble for doing it in the home, and his parents didn't really want to talk about it. They just said like, you don't do that here. And they didn't really know he didn't know what they meant by that. So he then started doing it out in their backyard, and then a neighbor called on him and he got in trouble for public masturbation. So again, just kind of the importance of using that more direct and concrete language to avoid some of those misunderstandings. We also have Maria, who was an individual who used AAC and was unable to give some examples of those abuse experiences that she was having in their group home because her AAC didn't have the words for that. And so it took a lot longer for us to figure out what was really going on in a way that we could actually hold someone accountable for what they were doing and for their actions. And it took a lot longer because she ended up having to draw things, kind of act things out. And it took a lot longer than if she just would have had access to that language. And then another one that I think is always just really important to point out is Clara, and she's an individual who I had a really wonderful conversation with one time about how she had a boyfriend. She had a really strong desire to, she was, they were having sex, they were engaging in all sort of different like sexual interactions. And she really wanted to do something like, just kind of like tell him whether or not it was feeling good. And she wanted to like maybe do a little dirty talk. And she was like, and I just can't, because I don't have any of this language on my AAC. Like she wasn't able to relay that information to him. And so just again, pointing out how not even just when it comes to abuse experiences or any of those more negative things, but also in order to have a more healthy, a more positive and healthy sexual relationship, we want to really be offering individuals access to that language. And a lot of that starts in sex ed when they're younger, and labeling, basic anatomy and physiology, and making them feel like it's okay to talk about those things. All right, so what are some of the things that are next when we talk about sex ed in general? We know that we need to make some policy changes in order to make sex education more accessible. But in the meantime, there are community programs and parent training programs. Those are key, and those do exist. And those are things that we need to kind of keep working on and keep offering. We also need to work at changing the societal views of sex ed as the big bad monster, recognizing that these are really important topics to talk about. These are things that need to be talked about in an open and honest way, so that, like I was saying, people have access to that language, they have access to that knowledge, so that we don't see some of those unintended consequences. We also want to just, I want to point out to everybody to recognize that, you don't have to know a lot about the topic. You just have to be open, you have to be honest, you have to be willing to deal with a little bit discomfort, because it is going to be a little uncomfortable. Sex ed is still the big bad monster in our society, right? So you have to be a little bit willing to deal with that. But if you're open and honest and you're talking with people about it, that's really the key, and that's the first step. All right, so let's move into talking about sex education. That's kind of general background. Let's talk about what it means to have sex ed that would be comprehensive and systemic. Okay, so when we think about comprehensive sex education, we want to be thinking about sex education that covers all of the topics that could fall under sexuality. And a lot of times the key thing to think about and point out is that that also does include romantic relationships. We tend to think about sex ed as, like I've been saying before, anatomy and physiology, as well as thinking about it, as kind of this reproductive health, or even thinking about abuse experiences. But we want to be thinking about healthy romantic relationships and healthy sexuality as well. So one of the meta-synthesis that we conducted in looking at these kind of romantic relationship experiences of adults with autism, we noticed that there was very much like a strong desire for intimacy, but recognizing that there were a lot of restrictive programs, policies, and family rules that kind of got in the way. A desire for these friendships and peers, but a lot of other people kind of being in control of their social lives, and a desire for that sexual identity and experiences, but family, staffs, and society expectations that place barriers on that all kind of led to a lot of these issues that we see, such as loneliness, the idea of sex as having to be secretive, so, possibly punished for having some of these intimate experiences. So just wanted to kind of point out, when we think about comprehensive sex ed, a lot of times this is the key piece that is often missing for a lot of individuals, is this focus and this recognition of these romantic relationships. So let's think about comprehensive sex ed topics. So when we want to include all of the things that I've already kind of been talking about, what is it exactly that we want to include in comprehensive sex education? So it usually falls under 4 kind of distinct categories. So the first category, and these will kind of go a little bit, and we'll talk a little bit about how they kind of build on each other and can be a little bit more of a tiered model. But the first topic that we want to talk about is biology, and is biological and reproductive. So this includes things like anatomy and physiology, those sex differences, issues of pregnancy, and issues of birth control. So kind of some of those basic individual level, things that we need to know about our own sexuality, about our own bodies, on that biological and reproductive kind of baseline level. Then we also want to make sure that we include things like health and hygiene. This is another piece that's often alongside those romantic relationships that's often sort of not included in when you think about a lot of sex education. So we do talk a lot probably about kind of a couple bullet points down there, like STD and HIV prevention. Those are things that sometimes are more covered, but we don't always think about just talking about it in the way of general hygiene, especially like hygiene of our, different parts of our anatomy that are related more specifically to sexuality, right? We talk about health and wellness, alcohol and drug use, like I said, it's STD and HIV prevention, STD epidemiology, and body and disease. So just a quick example of why including this stuff would be really important. We have an individual who I worked with named Mike. So Mike was someone who always kind of had some issues with hygiene, had some issues with basic health and wellness, and with keeping up with kind of his basic, healthcare needs. And this was an individual who also had not received any of this information. And he went on to have a bunch of unprotected sex with one individual, or one specific person kind of over the course of a weekend, but really had no idea, what an STD was, why he should be protecting himself against that. And he did end up getting an STD. And then he also, because of his issues with health, with his kind of hygiene overall, really didn't take care of what was going on for him for more than a few weeks. It kind of took him a few weeks to finally say something to me, to the point where I was able to say, you really need to go to a doctor and you need to get that looked at. And he really had no idea where it would have even come from, why it's something he should take care of. And so just really pointing out that it's very important to make these things very blatant, to give those concrete ideas, examples, and so also to be including that health and hygiene in the sex ed that we're teaching. So another overarching topic for when we think about comprehensive sex ed is relationships, like we've kind of talked about previously. So those relationship and social skills, the responsibility you have to your partner, different family types and roles, feelings and expressions, dating and marriage, parenting, and sexual orientation are some topics that could fall under the category of relationships. So to provide another example of why this would be important, we have Claire and Nate, who were a couple that I worked with. Claire had autism and Nate had some really significant but undiagnosed mental health concerns. And they actually had 3 kids who were constantly being removed from their home and then placed back in and then removed again due to issues of neglect. Was the most common reason that their children kept getting kind of taken away from them. And they had to have these kind of constant custody issues and fights, and eventually had to come see me and also had to take some parenting classes in order to get their kids back. And there was a lot of lack of knowledge on what it even meant to raise a kid. What are some of those different types of families and roles within families? And we had to do a lot of basic education before we even got to the core of, what are some of the mental health things that they had to figure out in order to gain custody of their children back. So just another example of why this would be a really important topic. All right, and then finally, for group 4, we have the self-protection and self-advocacy. So some of the things that would fall under there would be like protection against abuse, talking about sexual feelings, talking about sexuality as a positive aspect of the self, talking about sexual behaviors other than intercourse, appropriate and inappropriate touching, decision-making, safe sex practices, reduction of fear and myths, personal rights, sexual discrimination, and then how to say no to sex, drugs, and alcohol. So again, these are just some kind of examples of some of the things, and this is something that we tend to focus on in adulthood, especially once something happens or it tends to become an issue, or caregivers might realize that this is something that we need to worry about. And so like I said before, we tend to focus on number 4 in adults, we tend to focus on number 1 with younger kids, and then 2 and 3 kind of get left out there. But another little example of why it would be really important, we've already talked a little bit about some of this, just why talking about self-protection and self-advocacy would be important. But Katie is an individual who I worked with who didn't really know what it meant. So she kind of falls under 3 and 4 for these categories, but didn't really know what it meant to have a boyfriend, didn't really understand some of those terms, and managed to get herself into a situation in which another young adult who also had autism, who was a male, convinced her that basically having a boyfriend, if you give me a blowjob, then I'll be your boyfriend. And then he also talked to his friend, who then convinced her that that also would work for him as well. And then he talked to another friend. And next thing you know, she kind of had 3 or 4 guys who she was saying, oh, these are all my boyfriends. And was technically a situation where she was being very much taken advantage of. So just pointing out how that is also a really important piece to add in. So when we think about sex ed as comprehensive, we want to be covering all of these things. We know that you can't cover all of these things in just sort of one education class or one group. So let's talk a little bit about some of the ways that I have worked on kind of covering more of these topics in sort of different ways, and talk about how we can do this in more of a tiered model. So one of the community-based participatory research projects that I worked on was with this group called Aspire of Mid-Michigan. And they were running a group called their SHARE program, which stands for Sexual Health and Relationship Education Program. They didn't really have a super specific like curriculum that they followed. They had kind of a bunch of different things they pieced together, which is very, very common that you see out in the community, because it's something that people, they're like, I don't know where to go to find a curriculum or to find this information, but now I have some young adults who really need this information and I need to give it to them. So what can I do? And then they, put something together in order to provide a service, which is obviously not like ideal, but is really great that there are, organizations out there that are willing to do that when they see that need. So Aspire was one of those organizations, and they, like I said, kind of pieced together a lot of things. And one of the things that was really great about their curriculum is that they specifically left time where individuals would be able to write questions that they had on note cards and turn those in at the end of the session, or either the next day if they've had a week to or the next lesson when they had a week to think about it. And so they really wanted to make it so that they were covering the things that were important to the individuals who are in their group. And so we kind of got together with them and decided that this was a really great place for us to take some of our expert knowledge and take some of their experiences and what they've been doing and put those two things together to create a curriculum that would be very helpful for them. So you see up here on the screen, this is just kind of a model of our community engagement that we had with our different community partners. I'm not going to go into that super specifically. Again, if you have any questions about these, about this research project, let me know. This is one of those ones I could talk about like forever. So I'm more than willing to talk more about this. But so one of the things that we first did when we did this curriculum review is we took those note cards. You can see here there's some examples of what was written on some of these note cards. And we took them and we put these kind of up against what we know about sex education and comprehensive sex ed topics, which is what I just talked about kind of a few slides ago. And as you can see from here, these questions that they had sort of ran the gambit, right? They had questions about anatomy and physiology, like does the mother get scratches when giving birth to the baby? They had questions about relationships, like what are mutual friends? When is it right to date someone younger than you? One of my personal favorites, why do guys like boobs but not necessarily fat? Question that I'm sure a lot of heterosexual women probably have. But just thinking about, recognizing that these questions, they were asking questions that were relating to like cultural norms and questions that were relating to anatomy and physiology, kind of across the board. So we took these questions, we analyzed all of them. We analyzed them against what we know about comprehensive sex ed and what we know about the curriculum that they were delivering, did a bunch of different analyses, took these back to the community partners as well to say, like, this is what we're finding. What are your experiences? How could this work? Kind of having that, that mutual engagement. And what we developed from this is what we called the 3-part chair. So this is how we decided to make this curriculum that they were giving more comprehensive, is we turned it into a sort of 3-part group. So they, the first piece was about just general sexual health education that covered, like you could see there, just some of the more basic kind of individual level types of information. And then share 2 was focused more specifically on intimate relationships and sexuality expression. So kind of some of those more sexuality things that we already talked about in share 1, but instead of just thinking about it individually, relating to that like more interpersonally. So if you talk about, safe sex practices, how do you talk about actually engaging in those safe sex practices with another individual? If you talk about sexuality and sexual orientation, how do you actually engage in talking about that? Or what does that mean for your engagement with other individuals? And then we have share 3, which was more of a dating and relationships within the real world. So we talked specifically more about online dating. We had community outings, a lot more about kind of putting this knowledge into practice. And that was a lot more kind of where instead of having really structured information, we did a lot more of just kind of question and answer type of stuff in share 3. But we made it so that, you kind of had to go through the whole program. Like you couldn't just start at share 2, you had to go through share 1 before going to share 2, so that we ensured that sort of basic level of knowledge. And that's just an example that we did in how we made a sex ed curriculum more comprehensive. So one of the things to think about for yourselves for, moving forward, and if, wanting to give this information or think about making sex education more comprehensive and making it more developmentally appropriate, is to think about it and having some more of these sort of tiered models of intervention. So thinking about how, there might be at different levels, different types of information that you want to be given, and how you might want to individualize those as needs become more like targeted, or there might be more specific information once they gain that base level of information. So you want to think about who should be involved, the topic or setting, based on things like size of the group and things like that, and then the method of delivery or the intensity. So just recognizing that you don't have to cover all of those comprehensive sex ed topics that we talked about all in one go, that doing a more tiered model of intervention would actually be much more helpful and much more developmentally appropriate as well. So a few things to note when you're thinking about this: assessment is key. We want to make sure that we know what level of knowledge they previously had, what level of experiences they've previously had, so that we can make sure that we're giving the information and the method of delivery that's the most useful for that person or for whoever you're working with. Recognize again that many different things fall under the umbrella of sex ed. You're not just going to be talking about anatomy and physiology. You're not just going to be talking about safe sex. You're not just going to be talking about relationships. You're going to be talking about a whole bunch of different things, which again might be basic health and hygiene. And that's something that could easily fall under sex ed that people, again, don't always think about. So recognizing that as well. Recognize that we need to think about knowledge and behaviors. It's not just about giving that knowledge, it's also recognizing what that means for the person, what that means for their behaviors out in the community, and trying to be a little bit more concrete with that information as well when applicable. And also recognizing again that healthy relationships are just as important as a lot of that basic sex ed knowledge. So going back to that point, that healthy relationships are sometimes often kind of left out as well. And so wanting to make sure that we're thinking about sex education more comprehensively. All right, so let's also talk about what it means, not just to have sex ed that's comprehensive, but to also have sex ed that would be systemic. All right, so when we talk about thinking systemically, that basically just means about thinking about all of the different systems that could possibly be a part of or engaged with the individual. So we have kind of just an example there with just a couple of different circles. And obviously these are just a few examples. There's probably way more people and groups and things that could be included in here, but we want to be thinking about how you have the individual, but you have sort of these other different layers of people who are involved with them, who are part of their system in different ways that could also be utilized in multiple different ways when we're offering sex education or thinking about sex ed, because sex ed doesn't also just have to be in a classroom with, a bunch of information on a slide that we're given to people. This also can happen out in the community. It can happen in multiple different ways. So we want to be thinking about some of the more, kind of immediate people you can think about are people like parents, siblings, friends, same age cousins. You also could think about, when you're thinking systemically, think about a kind of even further out, like medical providers, community providers, educators, therapists, how they might be able to be involved in different ways, have different types of conversations, provide different types of education while also providing, different types of, kind of help, different types of not just like, education, but actually like talking through some of these things as well. And we need to also even be thinking about kind of even further out things like, media, pornography, some of those cultural values and how those are potentially impacting the individual and the information that they're receiving. So I'm going to talk specifically more about parents because I am a couple and family therapist. And so that is where my area of expertise lies. So I'll kind of run through a bunch of these different sort of examples and a bunch of different things that I've done. So again, if you want to know more about any of these studies or whatever, just feel free to let me know. One of the first things we did is we looked at we did an article review where we looked at parent involvement in sex education. We found that out of 92 articles that we looked at, most of them have only been published since 2000. So this is still a little bit more of a newer phenomenon, but we found that a lot of them focus on either attitudes or communication. So how parents felt about sex ed or how they communicated around sex ed with their individual. And very few actually focused, a lot of them did, but focus on intervention. And a lot of those ones were more focused on how parents help develop an intervention, not necessarily parent involvement in an intervention. So a quick example, kind of community example I have of this is the parent groups that I ran through an organization called ROI. And so these were groups that were actually parent initiated because they had some questions about sex ed, but whether or not their child should be in sex ed, what it meant, that kind of thing. And so they very much initiated the sort of parent group that we put together. And within each parent group, what we did is we supplemented the sex ed that their child was receiving in school. So we provided more further information to the parent, because also this was occurring in the state of Michigan, which is an abstinence only state and also is very restrictive on who can teach sex ed. So we were trying to provide some more information for the teen through the parent, because that was kind of the way that we had to do it there. But so we supplemented a lot of that sex ed. We also were really just focused on increasing that comfortability with parents with talking about these topics, as well as helping them to recognize that you don't have to say and teach everything. You kind of just have to do something. And if you can just do something that can be extremely helpful. All right, so I also have, again, a few more studies I want to just kind of briefly mention to you. So I have 2 studies specifically that kind of go hand in hand. And the first one, and this is my dissertation study, so if anyone wants to talk more about this, I'm always more than willing to talk about this study in particular. I've got a lot of information, but I ran a mixed method study in looking at parents who had an adult with an intellectual or developmental disability and a young adult child who was typically developing. And we asked them a lot of questions and did some surveys as well. And then we just sort of a follow-up interview where we looked at we did 15 interviews with the adults themselves who were currently in romantic relationships. And really the goal of all of this is we were looking to examine some of their experiences with sex education, examine their experiences of romantic relationships, and examine how that systemic involvement might be different for individuals with an IDD. So some of the things that we found, again, I'm not going to go through this like super specifically, but we found that there was a really drastic difference in parent level of involvement for romantic relationships, for sex education. They had to do a lot more monitoring. They described their role very differently. They called themselves a coach for their adult with an ID, but they called themselves just more of a counselor for their typically developing adult. So really kind of drastic different roles between these 2 adult children. And we also know, kind of combined with that second study, that both parents and adults talked a lot about this sort of impact of that lack of knowledge, that lack of basic sex ed knowledge, and how that's been impacting some of their experiences. The importance of support personnel, so the importance of having those parents and having those individuals there with them, as well as some of the experiences that they had around discrimination and some of the sort of everyday issues that they experienced as well. But in relation specifically to what we're talking about today, that lack of knowledge and that importance of the support personnel were kind of key things that we found from these studies. So some of the things to note about including systems, we want to always be thinking about who can get involved and at what levels, because it may not always be someone that you automatically think of, but it could still be someone who, could be involved at a certain level or could provide a certain level of education or help. So we always want to be thinking about that, who could get involved and at what levels. We want to recognize that adults with autism desire these romantic relationships. A lot of times they just might need a little bit of extra help to see that vision through from individuals and different systems around them. And going back to that idea of policies and how we have, a lot of policy restrictions around relationships, around sex education, it might just take a multiple, different people and groups of people to help kind of get at some of that knowledge, that information that we need. So being aware of all of those is also a great way to, once we're aware of those, we can think about how we can include those systems a little bit differently. All right, so some key takeaways that I want you to just kind of walk away from this presentation, hopefully knowing or thinking a little bit more about how it relates to you, how you might be able to, understand this a little differently or interact with this information a little differently. So again, we want to remember that we want sex education that is comprehensive, systemic, and developmentally appropriate. And when we say comprehensive, we mean all inclusive in terms of topics. And again, be thinking about those tiered levels of interventions. When we say systemic, we want you to think about who to involve, in what ways, and also be thinking about some of those policy issues that might be coming up for your young adults in, kind of in relationships and also in their access to information. And we want to make sure it's developmentally appropriate, which also goes along kind of back with what topics and at what level of intervention we want to be giving that. And how all of that can really lead to that increasing health and well-being, decreasing those abuse and exploitation experiences, and creating better interpersonal relationships overall. So some things for you to think about in thinking ahead. We need to stop, viewing sex ed as scary. It's a really important and necessary component of health and well-being. And if we can kind of switch the narrative we have around that, we can start to kind of make some of those changes in the way we talk about it, the way we interact with it. We also need to recognize that there are a lot of programs and organizations already working really hard on this issue. They're attacking this at multiple different levels. I mean, we're doing it in the peers clinic as well, right? So that content is out there. We just need to increase access to it and engage, multiple different parts of those systems in order to enhance those services and make them actually useful and accessible. And so a key thing that you can kind of do looking forward, if this is something that you're interested in or something that you feel like the young adults in your lives could use, you want to be looking in your area and find some of those programs that exist. And if there isn't one, think about making it yourself. Reach out to some experts, talk to some local providers, and find other ways to educate yourself. So just thinking about the different ways that you can sort of interact with sex education in order to make it more comprehensive and systemic for the young adults in your lives who may not have had access to that information before. All right, so that is all that I have. Thank you all so much for listening. And I look forward to if you guys have any questions or anything, but thank you all so much for listening.
All right. Well, thank you so much, Dr. Kamas, for that really, really interesting lecture and very useful information that you provided. Much appreciated. We do have some questions from our audience, and if people would like to send additional questions, we will be reading them anonymously throughout the last few minutes here. The first question that came in is, are there any resources or links that you can share that we can use with our patients with autism when it comes to sex education?
Yes, absolutely. I am not sure the best way. I don't know, Dr. Lagerson, if you know the best way to get that information out, but I do have whole resource lists and stuff that I can send to people. So yes, absolutely. There are websites as well as different manuals and things like that. And even sometimes just simple videos to watch that can sometimes be helpful. So yes, absolutely.
Yeah, we will be posting Dr. Kamas's lecture on the UCLA Tarjan Center website, as we do with all of our distinguished lectures, and perhaps we could have a link to some of those resources. That would be great. Thank you for that. Kind of related to that, someone wants to know if they can have the slides, and so that's sometimes something that we also offer as part of this lecture series, again on our website, or if Dr. Kamas is okay with that. We would be happy to post those also on our center website. Another question that came up was, well, first of all, they're thanking you for this wonderful presentation. And they're curious about ways to assess knowledge about sexuality and sexual history. So are there certain questionnaires or other approaches that you would recommend for clinical use and or for research?
Yeah, absolutely. So there are a couple of the Sex Ken ID is a good one. It's like an interview, but it takes a very long time to administer because it is more of a interview style. So that's kind of the more comprehensive one. And then there are people who have taken that and done kind of little different versions of the Sex Ken ID as well. But I think for clinical use, I think a really great thing to do is just to kind of take, one of the easiest things is to take, some either curricula or whatever it is that you're thinking, whatever topics it is that you're thinking about asking, or thinking about teaching or talking about, and just kind of asking them about those directly, because there isn't really a great clinical. There's a couple of different measures that kind of want to get at different abuse experiences. So there are some for that, if there's kind of for different couples for IPV and sexual violence experiences, questions about intimate relationships. But when you're talking about just general knowledge, there's not really that many great specific assessments. So yeah, clinically, one of the best things you could do is just kind of take the information that you're wondering if they have or don't have and just kind of ask about those directly. But there are also some different sexuality curricula that will have assessments in the beginning, or ways to kind of, at the end of each chapter, they'll have a way to test knowledge, and you could just kind of use those as assessments as well. So yeah, those, but the Sex Ken ID for research, I think, has been the most commonly used for assessing sexual and relationship knowledge, but it does take a while to administer that one. Yeah.
So it sounds like there's definitely a need there for some better assessments.
There definitely is. Yes, absolutely.
So kind of related to the research aspect of this, another question is, are there any evidence-based sex education programs for adolescents and adults with IDDs?
Mm-hmm. So there have been, it depends on, again, what sort of specific topic you're looking at as well, because there haven't really been too many kind of more general or comprehensive sexuality curricula, especially for teens. But when you talk about young adults, there is a lot more of programs there. And I do have somewhere, again, if that's something that people are interested in, I can provide like a list of different curricula that have been more evidence-based, but there's like one out of the University of Alaska Anchorage that's very focused on IPV. That's a really great one, specifically though around intimate partner violence. And there are people who are creating more and more of these every day, but in terms of very specific evidence-based programs. Like I said, I do have a couple that I could probably kind of name off the top of my head, or I could name if I had my list with me, but not, with teens, it gets a little more dicey as well, because a lot of times you have a lot of restrictions over who can provide that type of education within a school system and even outside of a school system for someone under the age of 18. Like in Michigan, we are not allowed to provide that information for anyone within any type of school system or outside of a school system if you are not a like certified sex educator. And then you also have to get special permission from the state to do it outside of a school system. So it gets a little dicier there for teens. Yeah.
Yeah, I think, I mean, there's limited research in this area in terms of evidence-based treatments and that are publicly available. I think that's tricky. But one that just to follow up with that, one that I recommend often for at least those on the autism spectrum is Isabella Hanaud's work. She's out of Montreal and has a sex education program specifically for adults, and it's used sometimes with adolescents on the autism spectrum. I think it actually applies to anyone with an intellectual or developmental disability. So another question is, what programs are offered by UCLA?
So that I actually don't know. That might be a question more for Dr. Loggins. I don't know if you know of any specific, because I don't know of any other than our Peers for Dating that we are currently working on. I don't think there are any other sexuality education like that is specifically for individuals with autism at UCLA.
Yeah, I mean, I think this is where Dr. Kamas really fills an important need and gap in some of the services and research that's provided at UCLA. So we do have Peers for Dating, which is a program for adults on the autism spectrum that are interested in developing and maintaining romantic relationships. It does have a sex education component to it, not the focus of the entire intervention. But there's also, obviously individual services that can be accessed through clinics like the Child and Adult Neurodevelopmental Clinic, and we often can provide resources in the community as well. So thank you for that. Someone's asking if there will be a recording of this excellent presentation sent out. I'm just going to go ahead and say once again that if you go to the UCLA Tarzan Center website, maybe within the next couple of weeks, we should have a recording available there that people want to go back and read more about or hear more again about what you shared here. Another question is, have you seen any information as to whether the Gardasil vaccine, I'm not sure if I'm saying that correctly, being given to girls, and how healthcare professionals and parents discussing sexuality at that time?
Yeah, so I'm pretty sure you're talking about the Gardasil. And so can you read the?
Yeah, I think
I'm just wondering what. Yeah.
There's some words missing, I think. So have you seen any information about whether the Gardasil vaccine being given to girls, and I think there's something missing there, and how healthcare professionals, parents discussing sexuality at that time? I think this person is asking whether or not there's been much discussion about how that vaccine is maybe facilitating conversations about sexuality. I don't know if the person wants to retype in their question, maybe we can get some clarification.
And I think, because I do know that there was like a big push for a while, even with like advertisements for that. And I know it did provide an opportunity to have a very different conversation in providing that to, whether or not you were giving that to your like young daughters, and also whether or not you should be providing that with your sons and things like that as well. So I do think that it provided a little bit of a different an ability to have a little bit of a different context for that conversation, because that is something that, even though you don't want to be thinking about or worrying about STDs until later in life, if you provide that to your daughter at a very young age, it can kind of help, even later. So then do you, kind of having to think about that, parents having to think about that a little differently, being provided an opportunity to to protect their daughters a little earlier on, then they may want to think about those kinds of things. And I definitely think that I don't know if I have any specific examples or specific knowledge of whether or not that really impacted anything, but my guess would be that for some families, it probably really did, providing them a little bit more of a little different type of opportunity to have that conversation. And again, have that conversation maybe a little bit more of like a tiered way, recognizing they didn't have to go straight into talking all about every aspect of sexuality and sexual behaviors. They could just kind of talk about one specific piece of it by then talking with them about what they were going to be vaccinated for and all that. And I could imagine, and I would hope that did provide families with a lot of that, because that's what we're talking about, in recognizing that you want to cover all of those topics and you don't have to cover all of it all at once. It can kind of happen in a more tiered way. And so using an opportunity like that to where you can give them information as the parent, and then the healthcare provider could give them a different type of information. Potentially, if they had any, friends who had already gotten the vaccine, could give them a different type of information, and kind of utilizing those different people. And I don't know about if there's anything specific that did happen with that, but I could imagine there could have been, and that would be great if there was, for sure.
Great. Well, thank you for that. Just a couple more questions. So you mentioned that students with intellectual and developmental disabilities are more likely to opt out of sex education.
Mm-hmm.
And this person is asking, is that only an option? I think they mean that the opt-out option
Mm-hmm.
for students with intellectual and developmental disabilities, kids in special ed, or are these opt-out options offered to typically developing kids? And what have you found that educators are advocating to families?
Mm-hmm. Yeah, so it is not only offered, it depends on the state also as well. And the opt-out policies, they're supposed to be kind of only offered to individuals who have, a legitimate, what, they would call quote unquote, like a legitimate reason to not be, whether it's like, because it wouldn't be developmentally appropriate. So basically, you're not supposed to do the opt-out if you aren't part of special education services, or you don't have an IEP or something that would indicate why you shouldn't be in sort of a general education class. But especially around a lot of states, like I know two of my big experiences are like Michigan and California. And in Michigan, it's very easy to get an opt-out policy because they are an abstinence only state and they don't, really require sex ed. So a lot of times it just has to be an agreement between the parents and the teacher, and they can kind of pull their kid out. And I think that a lot of times it has a lot to do more so with family values and with families really worrying about the type of information that their child is going to receive and not wanting them to hear that from other people. And I think that depending on what the educator is, I think across the board, you see a lot more educators nowadays becoming much more, believing that sex ed is really important, and really kind of, advocating for that with parents, that they do at least come to some parts of it or get that kind of basic information. But I think it's still a very value laden topic. It's still got a lot of, like I was saying before, a lot of taboos around it. And so it does also really depend on kind of the educator's core beliefs and on what parents really want. But so technically, it's only supposed to be offered to individuals who shouldn't be part of that, gen ed group, or have reasons not to be part of that gen ed group. But really, in a lot of states, like I know in California, it's a little harder to opt out. You do need, if you're not in some form of like special education class, but there still are a lot of ways to for parents to get around that as well. And so, but I think that generally a lot of the educators I know are wanting their individuals to have that more, but I'm also in the research field, so they all a little different perspective.
Well, I mean, I think it also, if you're basically saying that this is an option for special ed kids, there's a bit of a meta message there, isn't there?
Mm-hmm.
About, that maybe it's not appropriate or something.
Yes.
If they're the only ones that can opt out. So is there sex education in schools? This is another question, modified for students with intellectual and developmental disabilities, and how?
Yeah, so there have been, and again, these are like just kind of personal experiences that I've had within some individuals, because there isn't necessarily like, especially in the state of Michigan and here in California, like no specific requirements around that, or no specific kind of help with that. But there are a lot of individuals who, once they are able to give that sex education course, they will create different kind of modifications for individuals. And definitely, I think in smaller schools, the ability to do that and to tailor it to what your students need, if you have smaller classrooms, is definitely a really big thing that a lot of educators will take the time to do. And a lot of places are doing a little bit more of including like parent components of that as well. So really bringing in parents to have sort of a supplemental kind of sex ed group where they also can learn how they can talk to their kid, because they're like, this is more important, especially for you, to instill your values and traditions into them and want to talk to them about that. So here, then instead of just expecting somebody else to do it, or to then be mad if someone doesn't do it the way you would want to, here's a way that you can go ahead and do it. So I think that's another way that a lot of places have begun to modify as well, by including that parent component.
Yeah, lots of great questions in the chat. I promise only to give just a couple more, and I think the last one will be really fast. But this one, first of all, the person is saying thank you so much for the great presentation. At what age is it better to start to talk about sexuality, and or to offer a sex education program for people with IDD? And also for adolescents without IDD, they're interested in both.
Yeah. So, I might be a little biased, but I think you should be talking about sex ed literally from day one. When you have a toddler and you're changing their diaper, you should be using the, correct terminology. You should be making sure to label things for them, to give them that information to start, kind of giving them that knowledge about who should and shouldn't be touching them, things like that. So like, I think sex ed starts from day one, and you should be having those conversations. And again, it doesn't have to be some big drawn out, birds and the bees talk, anything like that. It can be something just as simple as labeling the body parts with, the correct terminology, the medical terminology that, they're going to hear. So I think that's key for anybody with or without any disabilities. That's just kind of across the board. But when it comes to actual kind of sex education classes and groups, I think those definitely should be starting in like elementary school or grade school. And I know some places do that with kind of just basic, that health and hygiene, that basic anatomy, and, reproductive health, things like that. And so and there's a way to talk about those types of topics. And I think that it helps if they also build on each other. So the earlier that you can kind of start talking about those things, again, at a level that might be appropriate, it might just be labeling body parts. It might just be, preparing them for what's going to happen during puberty. And then after puberty, let's talk about, what these changes actually mean, what this looks like. And then we start, kind of layering those different levels of education. So, yeah, I don't know if that answered the full question. I forget all of what they asked, but just definitely starting that.
Starting early is what I hear from you.
Yep.
But I think one of the clarifying points was too, is it any different for kids with intellectual and developmental disabilities?
So no, I think that the yes and no. So no, in terms of all the topics, everything, the way you're going to talk about it, it all should be the same, because all of this information is necessary and it's the same for everybody. But potentially at what levels, depending on what would be more developmentally appropriate, depending on what level of kind of comprehension that the individual might have, when you start to attack some of those topics, might be a little bit different, maybe potentially delayed if you really feel like they're not going to be, taking that information. But there's also other different ways to give that information, like I said, you could just be talking about with toddlers, just basically labeling, and kind of, you have to decide at what level that would work. But I think there is also something to be said for the fact that for individuals with intellectual and developmental disabilities, you might want to tailor the sex education that they receive if there's something that would be more pertinent to them. So if someone has some form of physical disability, you're going to want to talk about how that physical disability might impact, their sexuality, the way they think about it, the way they talk about it, the way they experience it. And so depending on the individual, those things also would be ways that you would need to kind of tailor that message. Like I was talking about before with individuals with autism, talking about those sensory processing issues will definitely be a big piece of that as well. And so, figuring out what it is that individual might need, that might be a little bit different. Yeah.
Okay, great. Well, I know we've taken up a lot of your time. This last question is very, very simple. I think, how do you get more information about the SHARE and the ROI programs?
Yeah, so go ahead and email me if you have any questions about these. Aspire of Mid-Michigan and ROI Behavioral Consultants are out in Michigan, but they have their own website, so you can look up them as well. But you feel free to email me with any questions about any of those groups. Even if you're wanting to talk more about like your own curriculum, something you're developing or someone you're working with or something like that, I love to consult on things like that all the time. So yes, feel free, email me whenever.
All right. Well, you are a great resource. Thank you so much to Dr. Kamas for this very interesting, very thought-provoking lecture, super informative. If people have additional questions, you can feel free to reach out to the Tarzan Center directly or to Dr. Kamas. Again, we will be posting this webinar on our website shortly, and you all can access that publicly very soon. But in the meantime, thank you again so much to Dr. Kamas. We really appreciate your information and sharing all of this useful info and resources with our group. Thank you. Best of luck, everybody. Happy Thanksgiving.